For the first time, a health crisis has shut down the entire world economy, showing how connected healthcare and the economy have become. Our conversation today seeks to address the impact of COVID-19 on healthcare and what the new norm could possibly look like. Conversing on the topic together with us today, we have Dr. Phusit Prakongsai, the Senior Advisor on Health Promotion from Ministry of Public Health in Thailand, Dato Dr. Adeeba Kamarulzaman, Professor of Medicine and Infectious Disease at Universiti Malaya, and last but not least, Dato Dr. Jacob Thomas, the Chairman of Ramsay Sime Darby Healthcare and Chairman of Healthcare Accreditation Organization Joint Commission International. My name is Amanda, and I will be your moderator for this panel. The session today will be split into a 40-minute discussion and followed by a 20 minutes of Q&A. However, to streamline the Q&A process, we would ask for you to submit your questions to the email address shown on the screen during the session later. Also, a word of disclaimer, I'd like to clarify that our speakers will be expressing their personal opinions and is in no way representative of the organizations that they are associated with. My fellow distinguished panelists, good afternoon and welcome. It's a pleasure to have you with us today. Perhaps we can get the ball rolling with Dr. Adeeba. Dr. Adeeba, where do you think we are today in the fight against COVID-19? And is this anything like the other infectious diseases that you have seen before?
Thank you, Amanda, and thank you for having me on this panel this afternoon. It's a real pleasure to be here, and Happy New Year to everyone. First of all, let me start by saying, no, it's not like the other infectious diseases that I've seen, including the other pandemics or epidemics and outbreaks that we've had, starting with, of course, our very own Nipah outbreak, which was severe and devastating economically as well, but it was short-lived as the epidemic went away as soon as we identified the source and culled the pigs. And then we had the SARS outbreak, of course, which Malaysia actually had a very mild outbreak compared to our neighbors, Singapore, Hong Kong, and other places. And then, of course, the AIDS epidemic. So each of these have been very different, but each of these epidemic, I think, have taught us a lot and should have had us prepared to face COVID-19. Unfortunately, COVID-19, by the nature of the virus, which is very easily transmitted, is silent when, in large part, the asymptomatic or pre-symptomatic phase is also still capable of spreading. And, the myriad of complications that it can cause. So there are distinct differences. And because of the ease of transmissibility and that it can spread even in the asymptomatic phase. That's why we are having a lot of problems controlling COVID-19. So where are we in the epidemic? I think if I can speak where we are for Malaysia first, we all know that Malaysia managed to control the first wave from international travelers and subsequently the public gathering very, very well, and had very low cases for many, many months until September. What we are observing now is, unfortunately, multiple clusters and outbreaks originally stemming from vulnerable populations like migrant workers and foreign workers living in cramped conditions, as well as detention centers and prisons. But in the last few weeks, we're also experiencing a spillover into the community. And I think it's fair to say that we have quite a significant spread in certain areas of the community that is causing a lot of concern, particularly in states like Selangor, Wilayah, and to some extent Johor. Globally, of course, you all know, many countries have managed to control the epidemic very well, including our neighbor Thailand and Singapore after the surge, also related to foreign workers, have also managed to control. But what we are seeing is even in countries that manage to control the epidemic well in our region, namely South Korea and Japan, are also experiencing surges. And then, of course, countries in the Northern Hemisphere with winter are going through a terrible time in the UK, in America, in Europe. They're experiencing quite severe outbreaks again. So, of course, the vaccine is a welcome news, but it will take time for that to come into effect, to control the pandemic.
Thank you, Dr. Adeeba. Dr. Phusit, if we could turn our attention over to you. It has been slightly over a year since news of the first COVID outbreak. How has Thailand's health system coped during this time? And what has been the most challenging aspect in tackling the coronavirus?
Thank you very much, Amanda. And first of all, I would like to thank the organizer for inviting me to share the perspective from Thailand. I would like to start with sharing with all of you about the current situation of the COVID-19 pandemic in Thailand, which seems to have the second wave of a pandemic starting from December last year. Currently, I think that the Ministry of Public Health Thailand continues to report a rise of new cases of locally transmitted COVID-19, most of which are related to the outbreak of seafood market at the Samut Sakhon province, and several clusters associated with social gatherings in many provinces in the eastern and central region, including Bangkok, Thailand. On January 4th today, 745 new cases were reported, of which 152 were locally transmitted. You can see from the slide that Thailand is on the second wave of the pandemic, COVID-19 pandemic. And to answer your questions on the impact of the COVID-19 healthcare system, perhaps I would like to divide my talk on the impact of the COVID-19 pandemic into three parts, from the public to the public sector and the private sector and the public health system. I think that after the response, the government, Royal Thai government response to COVID-19 pandemic, we experienced the shift of the government health budget and human resource for health and clinical staff in response to COVID-19. And we also experienced the reduction in the government health budget, resulting in negative impact of healthcare services for other health priorities in our countries. And also we have the problem of the decrease in the inpatients volumes due to the cancellation of the human resource of the cancellation of the elective care and government policies in reducing the number of inpatients for other disease. And also the government policy, they have the policy to reduce the number of inpatients volume to specific consultation clinics, such as rehabilitation, palliative care. And the government advised the hospital to prolong the follow-up period for chronic NCD patients. And we also experienced the problem of the government and public transport lockdowns, hindering access to the health facilities for patients. And clinical staffs were deployed to provide COVID-19 relief. In some areas of Thailand, we experienced the problem of the insufficient personal protective equipment available for healthcare providers to provide services. And would you like me to provide more detail on the impact on the private sector, Amanda?
Sure. If you could share a few points, that would be great.
Yes.
Thank you.
Yes. Perhaps all of you may know that Thailand is expected to serve as a medical hub and promote the medical tourism. In 2019, we have around 10 million of the foreigner patients visiting to the many top 5 private hospitals in Thailand. But after the COVID-19 pandemic, almost zero of foreign patients in top 5 private hospitals in Thailand. We experience perhaps almost zero of the foreigner patients. This is the problem that they have a negative impact on the private hospital in Thailand, that they rely on the medical tourism and medical policies. However, the private sector has played more active roles in the COVID-19 screening and testing, and also the quarantine system. They serve as the part of the alternative state quarantines and also the hospital quarantines for foreigner patients in many private hospitals. And for the public health system, I think that we have experienced the good, perhaps the positive impact from the COVID-19 in terms of the COVID-19 pandemic can strengthen the disease surveillance system and primary healthcare system, and strengthen the village health volunteers and community health system in our country. And also the COVID-19 pandemic also accelerate the progress and advancement of telemedicine, digital health, and clinical trials for vaccine development in Thailand as well. That's the experience from Thailand, Amanda.
Thank you very much, Dr. Phusit. On a related note, Dr. Jacob, from your end, how has private healthcare played a role during this COVID-19 pandemic? And, this may seem counterintuitive, but has there been any opportunities that have emerged from the pandemic that you see?
Yes, I think that, sorry.
No, it's okay, Dr. Phusit. Actually, that was meant for Dr. Jacob, but you can add a few if you'd like as well.
Thank you very much. Perhaps I pass to Dr. Jacob, yes.
Sure. Dr. Jacob?
Thank you, Amanda, and Happy New Year to everyone, especially to the participants and to our esteemed panelists. It's a real honor for me to be part of this distinguished panel. Your question about how has the private sector coped with this pandemic, I think what I want to say is initially it came with a bang, and most of the private sector panicked because we didn't know who was coming into our hospitals. And what we did was initially instituted safety precautions, and they were put in place. So we reduced the number of entrances we have to the hospital, and we started recording or monitoring the temperature of those coming in. And also we got them, the patients and visitors and even the staff, to fill in a questionnaire about what possible exposure they've had to people who could have come into contact with a COVID positive patient. The fear was mainly because of the asymptomatic people who were walking around but COVID positive. So we also in the hospital initially cancelled all elective surgery because we didn't want to expose the doctors and the staff to this unknown possible contamination of our patients. And we instituted PCR testing for every single patient going for surgery. And it became a norm to wear 3-ply masks for all, especially those in the outpatient areas. And for inpatient areas, for those doing procedures, they were required to use face shields. In addition, sometimes even a full gear with gowns and other protective PPE. So it is not just for staff and doctors, but also for vendors and even housekeeping staff who cleared our place. So the main hub for patients who come in was the emergency room. And we instituted screening and triage using tents which were erected outside the emergency room. And we had staff manning the place, and also we tried to minimize the number of our staff, non-essential staff who came into the hospital. So many of them were to work from home. And we had systems like Team A and Team B, and also SOPs to go by. We were very fortunate that we worked very closely with the Ministry of Health to do this. And hand sanitizers and hand wash was all part of the norm. And so that is how we started off. And our volume of patients, fortunately, initially dropped by about 70-odd%, but then it came up again. And we are quite pleased that now it's come up to about 80% of the normal. And yes, do you want me to go on to the opportunities we faced, Amanda?
Yes, that would be great if you could talk a little bit about that.
Now, we felt that this was something new, as Prof. Adeeba just said. We have not used to anything like this. We learned a lot of lessons because although it was a traumatic experience, we were able to adapt after the initial shock, going into seeing how we can support patients by not bringing them into the hospital, but treating them in their homes. So we brought in telemedicine and how we were able to consult with patients in their home, and using e-prescribing, we were able to send the medications to their house by some delivery methods. And these Zoom calls were very, very helpful, and even telemedicine, because we were able to reach out to them in their own homes without them having to travel by bus or by car and come and be exposed outside. Now, we also found that we were able to conduct seminars and webinars. I was told that one of our Indonesian hospitals had a giant webinar where 4,800 people dialed in. And that was a huge webinar, and people from all over the country dialed in, including Ministry of Health. The minister was also doing the opening, and this was something good. Now, the other thing which has changed is I'm part of JCI now, and one of our hospitals in Kuala Lumpur was due for a JCI audit, and it was postponed many times because the teams or the surveyors couldn't come here. But what happened was they decided that we will do a virtual survey. So we had 3 surveyors, one from the US, one from Jordan, and one from Switzerland. And they came in via Zoom. And we had 3 teams who used 3 cameras and 3 monitors walking around the hospital, looking at various aspects, including the basement and the rooftop, and were able to conduct over 4 days an excellent survey. And this is, I think, a first for Malaysia. It's been done in other countries, in Singapore, in India. But for us, it was a first time, and it was very clear. I was part of some of those discussions and deliberations. And I must say that after some time, you forget that this is a virtual survey. You think you are speaking to someone face to face, and because it was clear and the bandwidth was good. So I think what will happen in future is, because it was cheaper for the hospital, because you didn't have the travel expenses of the 3 surveyors, their hotel stay. So the cost was 1/3 cheaper, but you achieved the aim of having the survey done. So I think this might become the norm, that you don't have to have surveyors physically present, and we are able to do this. Now, the Zoom calls also go on with the ministries of health. We have policies being developed during this pandemic, regular meetings. And so video consultation and Zoom calls were part of the norm now. I'll stop there for now, Amanda. Thank you.
Thank you, Dr. Jacob. Similar to what Dr. Phusit and Dr. Jacob have shared, because of the COVID, technology has helped with a lot of industries, especially healthcare as well, to cope with the pandemic. So switching gears a little bit, Dr. Adeeba, promising developments on the vaccine front have sparked a lot of the market optimism, boosting stock markets. However, based on your experience and past incidents with infectious disease, do you think we could be close to the pandemic as we all are hoping for? And where do you see the future of healthcare going forward? Thanks.
Yes, of course, the development of the vaccine and in fact, some countries have already started vaccinating, as you all know, is super exciting. It's nothing short of a miracle, actually, that, a year since the disease was first described and we're now having thousands and thousands of people being vaccinated. It's pretty unprecedented, and it actually speaks to the amazing scientific advances and collaboration that has occurred worldwide. Having said that, is it can we relax? And the answer is no, because you just heard earlier, before we came on, Dr. Phusit was saying in Thailand that they'll probably start vaccinating in March. And I think in Malaysia, it would also be around that time. It's going to take time to get millions of people vaccinated. And, we don't know what the magical number of population immunity that needs to be achieved before the pandemic comes to a halt. I think conservatively, you hear numbers like 70-80% population immunity has to be achieved before we can breathe a sigh of relief. So that's a lot of people. That's in the case of Malaysia, that's vaccinating more than 20 million people. It's not an easy feat. And secondly, how long the vaccine will last in terms of the immunity, we also don't know yet. What we need to do is whilst we get everyone back, as many people vaccinated as quickly as possible, we will still need to live with the virus and practice all those restrictions and behavioral change masking, socially distancing, don't gather in crowds, etc., etc. I would say well into this new year, till the end of the year. So sorry. No letting up yet, and particularly not now as we see quite a lot of spread going on in the country.
Yes, we understand. Thank you, Dr. Adeeba. Similarly, Dr. Phusit, if we could get your view on this as well, what is Thailand's take on how to handle the pandemic? And, is it similar to what Dr. Adeeba has said that, potentially end of the year? So in the meantime, what do you think are the key factors in curbing transmission for the COVID-19 virus?
Thank you very much, Amanda. I do agree with Dr. Adeeba presentation and comments on the vaccination. And from my perspective, I think that the vaccination of the COVID-19 vaccine depends on the vaccine efficacy and safety, and also the availability of effective vaccines at the national and local levels. Because from my perspective, I think that we have a lot of questions on the immunity and perhaps the safety, and perhaps if we have efficacy vaccine that quite efficient, we still have the problem of how to distribute, how to vaccinate the vaccine to all of the Thai citizens, because in Thailand we have around 70 million of the Thai citizens, and we also have 4 to 5 million of migrants who are living in Thailand right now. So the question is that when we can have perhaps the vaccine for all who residing on the Thai soil. So this is the big problems in Thailand right now. But I'm quite optimistic that in Thailand we just have a discussion and negotiation with Sinovac vaccine from China, that we will have 800,000 of vaccine in end of February this year, and another 1.2 million of Sinovac vaccine in next month, in March 2021. And we aim to produce the AstraZeneca vaccine from Oxford, collaboration with the Oxford University, perhaps 200 million doses by end of this year. So this is our plan. But the problem is that how can we distribute and how can we vaccinate this effective vaccine to all citizens in our countries? So my question is on the same questions as Dr. Adeeba has raised. And to answer your questions on how we can curb this second wave of the pandemic, I think that it depends on the coverage of the vaccination, and perhaps we have to introduce the more strict measures in terms of to avoid the social gatherings, and perhaps try to promote the individual protection by wearing a face mask, and perhaps try to promote everyone to cleanse their hands, and there's sanitation, have the food sanitation. So this is the key issues that we aim to promote, to introduce for the second wave of the COVID-19 pandemic. And over to you.
Thank you, Dr. Phusit. Actually, maybe if we can follow up with another question for yourself, Dr. Phusit. As an official in the public health sector yourself, do you see any opportunities for the private healthcare side to fill in the gaps? And if so, where?
Yes, I just would like to echo on Dr. Jacob experience in Malaysia, that private sector in Malaysia play an active role in providing the healthcare services for COVID-19 patients. But in Thailand right now, we just have perhaps around 3,000 cases, and most of them are just subclinical cases or asymptomatic cases. So we still have availability of the ICU beds and perhaps the respirators, and we're still not in the situation of the shortage of these equipments in Thailand. But perhaps in the future, if we can control the pandemic situation and we don't have too many, if we won't have too many cases, so perhaps the public sector in Thailand can get involved, can handle these situations. But unfortunately, if we have the problem of the pandemic and the public sector cannot handle this situation, perhaps we have to rely on the private sector. And the private sector in Thailand right now, as I said earlier, that they play an active role in testing and screening, and perhaps they try to play an active role in the quarantine system in Thailand right now. So that's the situation in Thailand.
Thank you, Dr. Phusit. And Dr. Jacob, if I could touch a little bit on, where do you think the healthcare industry's future stand? Do you think COVID-19 is a game changer for healthcare? And could this be a call for us to further invest in public and private healthcare services?
Amanda, I just want to, I might not have been very clear. Dr. Phusit, we in Malaysia, the private sector, we don't treat COVID positive patients. But in Indonesian hospitals, they do treat, they do admit. In Malaysia, we are very fortunate that if we come across a COVID positive patient, the Ministry of Health, the public sector will immediately take the patient and admit in one of the 7 designated COVID hospitals. So as you said, we only do the screening and the management of non-COVID patients. We take off the load from some of the public sector hospitals. Now, I just want to say that what opportunities do we get from this pandemic, and how can we move forward? I think this pandemic has been an eye-opener that the public sector and the private sector need to work closer, and how we can support each other. This is something which we, the healthcare in the country, has been grappling with for a long time. And somehow these two different sectors have not worked enough for us to benefit from the strength of each other. So this is an opportunity, and I think we are now realizing that we need to share some of our resources and look at how the excess capacity we have in the private sector can be utilized from some of the patients who are overloaded in the public sector. And I think even this morning I was at a discussion where the Ministry of Health was asking, can private hospitals manage to treat COVID positive patients? I think the infrastructure is okay, but the manpower needs to treat a COVID positive patient is a lot. Having realized how much of a burden that is for the hospitals like Prof. Adeeba's hospital and some of the other big public hospitals designated to treat COVID patients, especially those who are in ICU, because many of the private hospitals today don't have intensivists manning their ICUs on a 24-hour basis. So these are things which we have realized, and we need to look at how we can make sure we have enough of such personnel to monitor and manage a ventilated patient in a private hospital ICU on a 24-hour basis. And these are some of the opportunities we have to upgrade our facilities to an extent where we have the capability of treating these patients. We can manage cardiac cases, cardiac bypass patients, we can manage liver transplant patients, but when it comes to someone like a COVID positive patient who is ventilated and who needs intensive care, we find we are lacking. So the private sector has a lot to learn, and we need to equip ourselves not just with the equipment needed, but also the manpower needed, the skilled manpower to manage this. And we in the private sector is realizing now what hospitals like the one Prof. Adeeba works with has gone through, and how we have sailed through the first wave. And now when it comes to the second wave and the third wave, we find that we might need to work together closer and look at how we can cooperate. So yes, we need to look at the capability of the private sector, and we need to look at working closer. And this is something which this pandemic has pushed us to do, something which we have been talking about for a long time, but we have not really embarked on something like that.
Thank you, Dr. Jacob. It's interesting that you've talked about, closer cooperation between the public and private healthcare brought about by the pandemic. So, Dr. Adeeba, just out of curiosity, do you think universal health coverage now can be a reality in the ASEAN region? Maybe not in the next 1 to 2 years, but could that be something that is a little closer to reality now that the COVID has happened and, public and private healthcare both alike have realized the importance of working together and increasing their investments in this industry? Thanks.
Yeah, I think universal health coverage and universal health care is almost an imperative now, isn't it? From what we've learned from the COVID pandemic. As you can see, one of the negative predictors or one of the predictors of a negative outcome is the inequities, that we see happening in very, very wealthy and developed countries like the UK and the US, where the stark inequities have led to their citizens not having access to healthcare and having poorer outcomes. To a certain extent, we saw it in Sabah as well, where many of the people who end up coming to hospital later and having a poorer outcome and dying from COVID are those who either are undocumented migrants or live very far away from large hospitals and therefore have poorer access to care. And so I think, Malaysia has been talking about having a national health insurance and universal, health insurance for many, many years. It is time that we look at it even more seriously. Having said that, we kind of already have universal health coverage in terms of the public health system that we have with extensive clinic kesihatan all around Malaysia. But as we all know, they are so, there's underinvestment in many of these centers, particularly those outside the big cities. And secondly, we really need to do something about our human resource for health. So all this can only be paid for if the investment into health is larger than what we have now. I believe it's 4% of the GDP. It's for our level of development, it needs to be sitting at least double that. So how do you pay for that? I mean, we have to be more creative and look at, a different way of providing universal health care for everyone.
Thank you, Dr. Adeeba. Dr. Phusit, is that also a similar focus that Thailand is heading towards because of the pandemic? Is the government now considering investing even further in public health care?
Thank you very much, Amanda. I would like to echo on what Dr. Professor Adeeba has mentioned about the importance of achieving universal health coverage. Because right now, Thailand has already achieved universal coverage since 2002, after the recovery of the Asian financial crisis in 1997. So apart from the universal health coverage, we provide also the health insurance coverage to migrant workers in Thailand, because we just established the migrant health insurance, but unfortunately, this is for just documented migrants or legal migrants only. But for those who are undocumented migrants or entry into Thailand illegally, we just, the Ministry of Public Health just have the cabinet resolution to provide health insurance. We call this is the migrant health insurance for undocumented migrants. But the coverage of the migrant health insurance for undocumented migrants is still low, just around 30 or 40% of undocumented migrants countrywide. So I think this is the situation in Thailand, that we have a lot of many things that we have to do to provide health insurance coverage and universal health coverage to all of those who residing or living in Thailand, because otherwise we cannot control the disease, pandemic of the disease, if they cannot access to essential healthcare services or to vaccine for all in the near future. So from my perspective, apart from universal coverage, perhaps we need a strong primary healthcare system, strong disease surveillance system. And also it's quite fortunate for Thailand that we have a long-term investment in health infrastructure and human resource for health production. So this is the key issues on the health system strengthening, that we have to strengthen our health system in all nations, in all countries, to protect our citizens, or perhaps to protect our people, and also to control the pandemic of the COVID-19. So this is my perspective on the universal health coverage and perhaps the key factors that we can control the COVID-19.
Amanda, yes, if I can jump in there, if I may.
Sure.
I think there's a lot of lessons that we can learn from Thailand, especially on how they are addressing the migrant population, both documented and undocumented, which is at the moment our blind spot. Well, it's not such a blind spot anymore, because we're seeing many clusters of COVID-19 infection arising from the migrant documented and undocumented population from factories and so forth. The other blind spot that we have and that has led to ignition of COVID-19 is prisons and detention centers. So I totally echo what Dr. Phusit has said, that we will not make, I repeat, unless we have a good grip of the migrant population, the detention centers, and the prisons. Right now, I'm sad to say, I don't think we have a very holistic, comprehensive approach to this. And, you know, we're testing, we're isolating, but the problem is far more complex than that. And it will require not just a health approach, but also legal approach. But most of all, it requires a humanistic, compassionate health for all approach that we in Malaysia are not really doing at the moment, sad to say. And we're paying the price. We're paying the price because, you know, infections in prison don't just stay amongst prisoners. Infections with migrant workers don't just stay among migrant workers. It spills over into the community sooner or later. And now we're grappling with the problem.
Yep, Dr. Adeeba, you're definitely right.
Can I also add on something to that? I mean, talking about universal healthcare, it came to be very, very key recently when the government wanted to refer non-COVID patients to us. And the big question was, how much will it cost? Or what will a reasonable cost be? So various private hospitals were asked to say for certain common diseases, what would be the cost? It was so varied, and the government felt that it might not be feasible to send patients to the private sector. So that's where we felt that for a good universal health system, we need to have DRGs and have some standard uniform fees across, whether it's the public sector or the private sector, in place. Now, we have tried many times to put in place. Unfortunately, there's a lot of lobbying. It becomes very political, and then we find that nothing is done. Now, we have started again together with the Ministry of Health and with the Association of Private Hospitals and some divisions, health economics divisions in the Ministry of Health, to re-look at it again. But the thing is, it can't all be provided 100% by the government, like what is done now. There has to be some participation by the public as well, for some contribution for it to work. Now, this is where we are now looking at public-private partnership or universal healthcare models which are available in Australia and sometimes in Singapore and other countries. And we can also learn from Thailand to see how successful it is and how some countries have failed to bring in their system, and the health system has collapsed. So I think it's timely that we somehow come up with such a model where we just have one system, whether you go to the private sector or public sector, the basic rates are the same. But if you want a more luxurious environment or something, you pay for it. But otherwise, access to healthcare is given to everybody. I think this pandemic has shown that we need such a system urgently, and I hope that is something we can all put our heads together and implement here, looking at the models we have around the world.
Indeed, Dr. Jacob. You know, I totally agree that at the end of the day, for healthcare to be equally accessible to all, it will require multiple stakeholders' involvement and everybody to be on the same page. I'm afraid this is all the time that we have today to discuss the highly relevant topic of the COVID-19 pandemic and its impact on healthcare. Once again, Dr. Adeeba, Dr. Phusit, and Dr. Jacob, it was an absolute pleasure having you on our panel. And it was a truly insightful session, and I hope for the participants as well. Thank you very much. And for our participants, you may now sign off.
Thank you again.
Thank you very much, everyone. Thank you very much.